Hello, I'm Didier from Geneva in Switzerland. And what I would like to introduce today is a new veneering technique called the edelweiss technique, which basically makes use of prefabricated composite veneers. What is very special with this technique is the use of a high quality composite material, which is heat cured under pressure at 300 degrees under 100 bars, which makes the material very strong. Actually, the physical properties of this material are markedly improved compared to a normal composite, especially a direct composite material. On top of that, the surface has been vitrified with a laser treatment, which means that you have no resin on the surface, it's only pure glass. It gives the surface of those veneers a very exceptional gloss. About the indications of this system, despite the high aesthetic quality of this system, we don't consider this system as a true replacement of conventional porcelain veneers. This is more to replace direct composite veneers, which are very time consuming to place and also technically very demanding. I normally need about a good hour to create a good quality direct composite veneer, while with this prefabricated technique I probably need not more than half of this time, since the entire shape and form of the tooth is already available. So I think this is a significant advantage for any patient who needs to get some veneers but who can't afford high-end type of restorations like porcelain veneers. And you can imagine that the price difference or the difference in the fees which we need to ask to the patient are really very, very different. We go for a much more cost-effective solution. And maybe I could mention a last advantage of this technique compared to a classical porcelain veneer is that everything is done in one appointment. So this is a one session veneer, but by using a material which has a very exceptional surface and mechanical properties. I take the lateral veneer, place it somewhere I hopefully won't lose it, and same as for the prep, my recommendation, let's say once again advanced operators might try to cement two veneers together, but my recommendation is to go with one veneer at a time. It's definitely easier to control. Like for any veneering technique, we like to protect neighboring teeth so that we don't bring any luting material, any bonding on the surface of the tooth, because otherwise we might run into troubles. Okay, we have no, that's something else. So we have for adhesion of this system, we have the Ultradent Peak adhesive system. We have a little brush for the application, which we can use to apply the bonding directly on the tooth. I will already prepare for the veneer a little drop of adhesive, which I will apply with a micro brush, because the other day I was bonding the veneer first on my fingers, and I will try not to replicate this. Otherwise, if we only have enamel on the tooth side, we'll proceed with etching and application of a thin layer of bonding, which you do not necessarily need to light cure. If you have both dentine and enamel surfaces, then you will treat them according to the adhesive system which we use. This is an etch and rinse system. So we'll have to shorten the etching time for dentine, as we said, 5 to 10 seconds for younger dentine and 10 to 15 seconds for adult dentine. On the veneer side, we sandblast the veneer and we apply directly the adhesive system. You might use a silane if you like. This is fine. It's a highly filled material, so it makes sense. If you wish, you can apply a silane. But if you proceed with sandblasting, it seems that it is good enough. But it is up to you. It is up to you. So once again, I do not simulate the etching procedure, and I will directly proceed with the adhesive application. Even though my prep is not extremely precise, I will blow off the excess of bonding and light cure it for 20 seconds before we proceed with cementation. Okay. If you only have enamel, you could even potentially avoid light curing the bonding. It's really up to you. Now I will apply just a little bit of bonding into the veneer. I will be very careful that once again this time I don't polymerize my fingers with it or already bond my fingers to the, and normally from there I don't need normally to light cure the bonding on the veneer side, so I will just hold it and or maybe just drop it on the side and prepare the material for cementation. So we have a neutral, as I said, I will use for the first one enamel neutral. Will give me a little bit less color. It will be let's say a little bit more the approach for an aesthetic case where we really want to make the teeth very very bright. But it's not a shade which is too opaque, so we'll still get a nice translucency. I think I've been very generous. Maybe I might take away a little bit of the material before going to the mouse. Don't thin the layer too much anyway, because you want the veneer to be without any defect underneath, because otherwise you might really sit. Normally when you have, I will just bring it now in front of the screen. Normally if you have applied a uniform layer, you should not see any white spot. A white spot being normally a bubble. So now I will bring it and I will exert a little bit of pressure, and I think it is in place. Must move it a little bit to the distal side, and when you have less excess, it's getting very easy with a spatula or with your fine sculpting instrument just to go along the margins. Feel that you have filled up completely the space, because you have little gaps. It's not like individualized veneer. It's normal that you have little, I need to clean my instrument. You have little gaps which you want to fill completely with your material. Just checking on the inside edge. It's perfect. It's nearly perfectly clean. And now we'll take away. I will take away the matrix. If the fit is not too bad, I should be able to do it in this way. And I think we can check maybe from an incisal direction to see that we have well fitting. I maybe have a little bit of material missing here, but I will fix. I will fix the veneer because I think I'm perfectly in place, and I will just add a little bit of material just here on the corner. I will go for 30 seconds, 20 seconds, 30 seconds, depending on the intensity of my light or the power. And I will do again from the lingual. Now I'm taking just a teeny amount of the same material I have used. Trying to clean the surface, and I'm not covering the surface. Can go with my glove. I'll just cure for 10 seconds, just the corner. And the difference now between a normal technique or a conventional ceramic veneer and this one is that I will do a little bit of finishing before I will move to the next use. What kind of finishing? The proximal finishing, especially on the side of the next veneer, because now I have a nice access which I won't have a little bit later. So I will take a small disc. That's probably less risky, and I will take the fine disc. So that I don't remove too much material. And of course, while you do this, you pay attention not to go too far toward the buckle, and that you don't damage the beautiful glossy surface. And what I will do before going further, now I'm back to a larger disc, is to probably change a little bit the incisal profile of that tooth. And I think it's not exactly, I would like to do something a little bit more masculine. I will also do a little bit of finishing on the lingual. And I think that's pretty much all what I need to do at this point. Maybe I can polish a little bit better with a finer disc on the distal and mesial. Taking a brand new disc. We just need to be very careful. And it doesn't take long. If we don't leave too much excesses, it's a relatively, it's not a huge work. But of course, better is the initial adaptation of your veneer. Less time will be needed for this. It's very so now if you look from a buccal perspective, I haven't used otherwise any specific polishing device. I will maybe just clean the model a little bit with water. I could probably even do a little bit more of correction on the. I can take my pre-polisher to maybe do a little bit more of. To do a little bit of characterization on the edge. Okay, here we go. So the only remark which we can do at this point might be that, well, we have a rather monochromatic type of restoration, but with beautiful surface shine, with very good proportions, with proper anatomical features. Means the buccal profile is correct. We have, you can see it from the light reflection, we have the right volume on the line angles. We have this nice. I would maybe try to show you that we are getting a little bit of micromorphology. Yes, now we can see it a little bit better. You see that we have a little bit of texture. We get probably a little bit more light reflection on the model. But we have really a nice, very nice. You see all the little reflections of the light on the surface of the restoration. Even without any characterization, you see a little bit of apparence. All this being relatively discrete, but let's say for a normal case, we are very close to a perfect result.